This is the overview for Chapter 12. In this chapter, we'll be talking about hallucinogens. The chapter also includes a section on depressants, but as we have been doing in these recent chapters that focus specifically on different types of drugs, there's just too much packed in to this chapter to be able to do justice to all of the different types of drugs. So what I'm going to do, I'm going to limit the discussion basically to LSD, one major type of hallucinogen, and then I'm going to leave it to you folks to familiarize yourself with the other materials, the other hallucinogens, and also the sections on depressants. So just follow the same strategy you have in the past where, you focus on these areas that I'm not able to cover, knowing that I won't be covering them, but you still get tested on them. And just go through them carefully, familiarize yourself with the materials, and I'll try to ask fairly basic questions that are really testing, did you read the material carefully? Okay, so let's jump in. Hallucinogens. What we mean by these are drugs that cause major changes in the way we experience the world around us, often distorting our own bodies or our personal concept of reality. So remember that the hallucinogens is one of the major big categories of drugs, at least as I see it, because I've talked about before how you have these drugs that either wind up your system, stimulants, or drugs that slow down your system, depressants, which are talked about in this chapter. Opioids do the same sort of thing, wind down your system. Alcohol is an example of a depressant, which has its own chapter, which also slows down the system. Well, that's a nice, speeding up, slowing down. That's a nice way to simplify a lot of different drugs. Hallucinogens, though, is a major category that's different than that because it's not really about cranking you up or bringing you down, slowing you down. It's more about a distortion of your perceptions, your experiences. So it's a different category, very different category of drugs. So it's an important one to talk about. And as I said before, it's really going to be LSD that we focus on in particular. Now, what do we mean by depressants? We're talking about these are drugs that bring us down to a lower level of conscientiousness, or consciousness. So this is another way of thinking of it, as opposed to sort of bringing down the speed, the intensity of the system. This is a way of thinking of sort of making you less conscious, heading towards closer and closer to sleepiness and sleep. So that's another way of thinking of these depressants. Some depressants, referred to as anti-anxiety drugs, help us in reducing stress and anxiety. So some people suffer from a lot of nervousness, getting stressed out, being very anxious, to the point of it becoming really dysfunctional in your life. And so these anti-anxiety drugs are designed to help reduce those feelings of nervousness, stress, anxiety, which can be very unpleasant. Other depressants, referred to as sedative hypnotics, help us fall asleep more easily or slow down activity in the nervous system. So insomnia is a common problem among people. People can have difficulty winding down, falling asleep, staying asleep, not waking up frequently during the night. So, a lot of people suffer from low quality sleep. So these sedative hypnotics can help with those kinds of issues, those kinds of problems. Of course, they have their negatives as well as their positives. Let's see here. Most hallucinogens, LSD, mescaline, psilocybin, and MDMA, are classified as Schedule 1 controlled substances, having been identified as illicit drugs with no accepted medical use. Okay, most hallucinogens do not have an accepted medical use, and so therefore, and then are considered serious drugs, and so end up being classified as Schedule 1 type drug, which indicates that it's a serious drug and one that doesn't have a lot of benefits. Well, it looks like it's not giving me one point at a time. That's okay. So these depressants, such as sedative hypnotics and anti-anxiety drugs, are classified as Schedule 4 controlled substances. And the reason why they're 4 and not 1 is it's not because they're not serious, they're powerful drugs. But they have been identified as licit drugs, or drugs that can be used legally, can be prescribed with an accepted medical use, for example, helping you sleep, helping you with anxiety. So that's why they get a different schedule. They're seen as having benefits as well as just, being the, drugs that get you high without medical benefit. Access to these depressions require a prescription from a physician or a qualified health care provider. A maximum of 5 renewals within 6 months is permitted. So there's a certain tight restraint on use of these drugs. They do have, these depressants can have side effects. They can be addictive, and so they're supposed to be dispensed, prescribed carefully with these restrictions. Hallucinogens can be divided into 4 groups. And this is interesting because the groups are sort of based on the chemical resemblance of the type of drug with different neurotransmitters. So the first group resembles the neurotransmitter serotonin. The second group, norepinephrine, another neurotransmitter. And finally, the third, acetylcholine. Now they have a final 4th group, which is basically a miscellaneous group, a small number of hallucinogens that really don't have a structure, a chemical structure, similar to one of these neurotransmitters. They still have hallucinogenic effects, but they don't look like these neurotransmitters at all. So they end up in a miscellaneous 4th category. Now you see here, I pulled this from the textbook, which shows some categories, some types of hallucinogens, and sort of which neurotransmitter that they resemble. I don't want to spend a lot of time on a table like this, can take a long time, but I could just quickly show or point out that you have the drugs that are related and similar to serotonin, a major neurotransmitter: LSD, psilocybin, and lysergic acid amide. So we're getting less well-known drugs here. DMT, again, these less well-known. The ones that are similar to norepinephrine: mescaline, MDMA, ecstasy, down the list there. And then the other ones less familiar. But that just gives you a sense of how these get categorized. LSD is one of the most powerful psychoactive drugs known. Okay, we're going to get into LSD now, the details of it. That's what I'm going to be, the focus of the chapter is going to be on. I find it's useful to kind of go into detail of major drugs as opposed to just touching upon very briefly lots of different ones. So let's get into the details of LSD. Its potency is so great that effective dose levels have to be expressed in terms of micrograms, 1/1,000,000th of a gram, often called mics. So it's it's one of these drugs where it only requires just a very small dose level, for you to feel the full-blown effects. The typical street dose ranges from 50 to 150 micrograms, though sellers often claim that their product contains more. So this is the range we're talking about, where you can get a dose that's working for you, that's giving you that full high, although the effective dose can be as small as 10 micrograms, of course, depending on the person, the experience, etc. With only 0.01% being absorbed into the brain. So the amount that's getting absorbed into your brain is a very small amount indeed. You can appreciate the enormous potency of LSD by comparing these figures to the fact that a single regular strength aspirin tablet contains 325,000 micrograms of aspirin. So a very clear contrast in the amount of the drug that you need for an effective dose, for it to work on and achieve what you're trying to get it to achieve. Okay, taken orally, which is how this drug is usually taken, LSD is rapidly absorbed into the bloodstream and the brain, and its effects begin to be felt within 30 to 60 minutes. Once its concentration has peaked in about 90 minutes, the elimination half-life, so basically the amount of time that half of the drug is processed, is metabolized, the time that it takes 50% of the drug to diminish in the bloodstream is approximately 3 hours. Okay, so they often measure these chemicals in terms of half-life. Within 5 to 12 hours, the effects will be completely over. Okay, so in terms of different types of drugs, this is a drug that has sort of a longer half-life, that the high experience is rather long for LSD. It's not some quick thing, 5 minutes and it's over. The toxicity of LSD is relatively low. A lethal dose of LSD for humans would have to be roughly 300 to 600 times the effective dose, the dose that you need to get the high. A fairly comfortable margin of safety. Remember in an earlier chapter when we were talking about one way to measure the dangerousness or the toxicity level of a drug is sort of like what's the gap between the amount of a drug that it takes to get you high versus the amount of drug that you would take that would kill you. The bigger that gap, the quote unquote safer the drug that is, because there's a bigger distance from what you need to get high to what it would take to kill you. So in terms of this measurement, LSD would be considered comparatively speaking, a quote unquote safer sort of drug, in the sense that we're talking about lethal overdoses, which is a very serious measure. You can still have a lot of things go wrong with the LSD high, which we'll get into later. But if you're talking about death, people don't die from just the effect of LSD. Yes, to this day there has been only one definitive case in which a death has been attributed solely to an LSD overdose. So not some other factor that's combined with the use of the LSD, just purely the drug itself alone has only killed one person that we know of with certainty. So long story short, it's not the kind of drug that kills people, generally speaking. LSD is sold on the street in single dose hits. It is typically swallowed in the form of powder pellets or microdots or gelatin chips, called sometimes window panes, or else it's licked off small squares of absorbent paper that have been soaked in liquid LSD, these papers being called blotters. So it's just different ways of taking the drug orally. It's all of these are by mouth, just somewhat different ways of how you're taking them. So initially, LSD produces an excitation of the sympathetic autonomic activity, meaning that it's in the beginning, it's kind of cranking up your system, increasing your heart rate, elevating your blood pressure, dilating your pupils, and a slightly raised body temperature. So in the beginning, there is kind of a cranking up of the system, like you might expect from a stimulant. And along with that, you might get a negative kind of feeling of restlessness, but you might get a positive feeling of that euphoria, of well-being, of kind of a happiness or joy, just a good feeling. And an inner sensation that inner tension has been released. So a release of tension might be the feeling in the beginning. There might be laughing or crying, depending on one's expectations in the setting. One thing you'll learn in this chapter about LSD is that the quality of the experience, the positivity or the negativity of the experience, depends quite a bit on the interpretation, on the person's expectations, on the other people that are with them, the environment they're in. A lot of these factors like this can turn this experience either positive or more negative. Let's see. Let's go ahead and stop there, even though we're kind of in the middle of this description, but we'll pick it up in part 2.